Hello from Ukraine, it's Dr. Rajeev Fernando, co-chair of the Infectious Disease Special Interest Group for the World Association of Disaster Emergency Medicine. Today I'm deeply concerned about the outbreak of cases in Western Pakistan for the Crimean-Congo fever. Let's talk about how this is transmitted for starters. It is transmitted through tick bites, exposure to livestock, and of course, contact between humans and infected fluids. At this point, I'll also go out by saying that with increasing ticks because of global warming, we are going to see more cases in the future. Symptom-wise, constitutional symptoms. Now, a smaller percentage go into a shock, hemorrhagic fever, and of course 30% actually die. Now, with regards to prevention, there is no effective vaccine to prevent Crimean-Congo fever. Treatment-wise, ribavirin is an old antiviral drug which has been used successfully in certain cases, but not enough data to actually conclusively use this antiviral. Now, what's important over here is to know how we mitigate this current situation. Let's start off by hospital mitigation measures. For starters, at the entrance, it's really important to have hand hygiene and other hygiene measures to make sure you prevent this. We are seeing many hospital workers infected. As of a few days ago, a physician died as well of Crimean-Congo fever. Now, once the patient actually, or the suspected patient actually walks into the hospital, it's important to place these people with this syndrome into a certain area for specialized testing. Once again, the most important thing is to wear effective PPE in this situation. We're seeing many cases of CCF on the medical floors. Unfortunately, sometimes it takes a while for the diagnostic test to return, and by then the patient has already transmitted CCF to many of the healthcare workers, which is why it's very important to have an effective rapid test or a PCR to quickly distinguish what cases they are. Of course, it's winter time approaching, so we are going to have flu, malaria, all three of these syndromes, malaria, flu, and Crimean-Congo fever, present in a very similar method in the initial phases. Now, other things in the hospital, with these cases rising, it's also important to make sure we prepare for a surge capacity. And with the surge capacity, it's also important to know that we have the special rooms to prevent a droplet sort of precaution. Now, there is data about a CCF virus actually being airborne, and that's why when you're any aerosolized procedure, it's really important to wear 95 in this situation. Now, what else? From a geopolitical perspective, I'm deeply concerned. With Pakistan, elections are coming up in the next few months, and I wonder if these situations are happening right now, it may impair the response, a coordinated healthcare response in this situation. Additionally, Afghanistan refugees are heading back into Afghanistan. Now remember, this is in the western part of Pakistan, a city called Quetta. And if these cases subclinically pass through into Afghanistan, I'm concerned cases could arise over there. Kandahar is the biggest city, and if these cases get into Kandahar, we are concerned about urban spread. So once again, it's Dr. Rajeev Fernando.